ARDMS Vascular Registry Review. Question number 1. Blank is useful in detecting the carotid string sign. A. Continuous wave Doppler. B. Spectral Doppler. C. Power Doppler. D. M mode. Answer is C. Power Doppler. Power Doppler is highly sensitive to low velocity blood flow, making it especially useful in detecting the string sign, a thin trickle of flow through a nearly occulted carotid artery. Unlike color Doppler, power Doppler does not depend on the angle of isolation or flow direction, allowing better visualization of severely reduced flow in tight stenosis. Question number 2. When scanning the proximal subclavian artery or vein in supraclavicular region, which color duplex artifact is most frequently observed? A. Mirror image artifact. B. Reverberation artifact. C. Acoustic shadowing. Answer is A. Mirror image artifact. The mirror image artifact is most frequently observed when scanning the proximal subclavian artery or vein in the supraclavicular region because of the highly reflective lung interface beneath the vessel. This strong reflector causes a duplicate mirror image of the vessel to appear below its true location, commonly seen in color Doppler imaging in this area. Question number 3. Which of the following sites is most commonly associated with the development of new intimal hyperplasia? A. Middle cerebral artery bifurcation. B. Venous anastomosis of arteriovenous graft. C. Pulmonary veins. D. Abdominal aorta origin. Answer is B. Venous anastomosis of an arteriovenous graft. New intimal hyperplasia is a common cause of stenosis and failure in AV grafts, especially at the venous anastomosis due to turbulent flow and vessel injury. It can also occur after procedures like stenting, angioplasty, or bypass surgery. Question number 4. A 60-year-old patient undergoes carotid ultrasound for a bury. A mass is seen at the carotid bifurcation with intense internal color flow and no sign of calcification or cystic change. The IC and ECR are pushed apart. What is the most important follow-up imaging? A. Doppler echocardiography. B. CT angiography or MRI. C. Pelvic ultrasound. D. Skull X-ray. Answer is B. CT angiography or MRI. CT angiography or MRI provides detailed vascular mapping and tumor extent, essential before surgical planning. Question number 5. Which vessels transport gases, nutrients, and other substances directly to capillaries? A. Veins. B. Venules. C. Arteries. D. Arterioles. Answer is D. Arteriole. Arterioles are small branches of arteries that lead directly into capillary beds. They regulate blood flow and pressure before substances are exchanged in the capillaries. Question number 6. Which term is used to describe the presence of abnormal cells within a tissue or organ that may indicate a precancerous condition? A. Hyperplasia. D. Metaplasia. C. Dysplasia. D. Neoplasia. And the answer is C. Dysplasia. Dysplasia refers to the presence of abnormal cells within a tissue or organ that often indicates a precancerous condition. It shows disorganized growth and changes in cell size, shape, and organization. Question number 7. Which arteries primarily supplied blood to the toes? Femoral and profunda femoris arteries, anterior tibial and posterior tibial arteries, dorsalis pedis and plantar arteries, popliteal and genicular arteries. And the answer is C. Dorsalis pedis and plantar arteries. Plantar arteries are from the posterior tibial artery. The dorsalis pedis continues as the dorsal metatarsal arteries, while the posterior tibial splits into medial and lateral plantar arteries together. They form arches that give digital arteries to the toes. What is the green arrow pointing to? And the answer is temporal tap. Question number 9. What is the another term used for the carotid body tumor? A. Schwannoma, thyroglossal duct cyst, C. paraganglioma, D. lymphadenopathy. Answer is C. paraganglioma. A carotid body tumor is a type of paraganglioma arising from neuroendocrine tissue. Question number 10. A carotid body tumor is typically located at which vascular junction? A. Bifurcation of the internal jugular and subclavian. B. Origin of internal carotid artery. C. Bifurcation of the common carotid artery. D. Aortic arch. C. Bifurcation of the common carotid artery. A carotid body tumor is a slow-growing, highly vascular mass that arises from the paraganglionic tissue at the bifurcation of the common carotid artery. On ultrasound, it appears as well-defined mass that displays the internal and external carotid arteries. Question number 11. In a color Doppler, what does the mosaic color pattern over a plaque typically indicate? A. Laminar flow. B. Turbulent flow from stenosis. C. Flow reversal. B. Turbulent flow from stenosis. A mosaic color pattern, multiple colors in one area on color Doppler indicates turbulence, often caused by stenosis. It results from rapid changes in flow direction and spread around a plaque. Question number 12. Which ultrasound artifact is also known as ghost artifact, resulting from refraction of the sound beam and producing duplicated or tripled images often seen in the midline due to strong tissue interference like rectus muscles? A. Shadowing. B. Ghost artifact. C. Reverberation. D. Comet tail. And B. Ghost artifact. Explanation. Ghost artifact is a type of refraction artifact. It occurs when the ultrasound beam bends as it passes through tissue of different acoustic velocities, for example, rectus abdominis muscle and fat, causing the image of a structure to appear multiple times side by side like a ghost image. This is commonly seen in transverse views of the midline abdomen. Question number 13. Which of the following is an intracranial branch of the internal carotid artery? A. Facial artery. B. Posterior communicating artery. C. Lingual artery. D. Superior thyroid artery. And the answer is B. Posterior communicating artery. The posterior communicating artery is one of the key intracranial branch of the ICA and contributes to the circuit of Willis, helping connect the anterior and posterior cerebral circulation. Other intracranial branches include the ophthalmic artery, anterior choroidal artery, anterior cerebral artery, and middle cerebral artery. Question number 14. Which complication is more likely with a peripherally located anterovenous fistula? A. Cardiac failure. B. Pulmonary hypertension. C. Ischemia of the distal limb. D. Deep vein thrombosis. C. Ischemia of the distal limb. A peripherally placed AVF at wrist or hand can divert blood away from the distal tissue, reducing perfusion and increasing the risk of ischemia in the fingers or hand. Question number 15. Another name of the internal iliac artery is A. External iliac artery. B. Common iliac artery. C. Hypogastric artery. D. Femoral artery. Answer is C. Hypogastric artery. The internal iliac artery is also known as hypogastric artery. It arises from the common iliac artery and primarily supplies the pelvic organs, gluteal region, and medial part of the thigh. Question number 16. Which of the following is the first branch of the external carotid artery? A. Facial artery, B. Lingual artery, C. Superior thyroid artery, D. Maxillary artery. Answer is C. Superior thyroid artery. Superior thyroid artery is typically the first anterior branch of the ECA and supplies thyroid gland, larynx, and adjacent muscles. Other branches like the facial, lingual, and maxillary come off further up the ECA. Question number 17. Which feature best distinguishes superficial thrombophlebitis from deep vein thrombosis on ultrasound? A. Compressibility, B. Vein size, C. Proximity to deep fascia, D. Echogenicity. And answer is C. Proximity to deep fascia. Superficial thrombophlebitis affects vein above the deep fascia like the great saphenous vein, whereas DVT affects deep veins beneath the fascia. Question number 18. Which of the following structures receive blood supply from the renal arteries? Kidneys, adrenal gland, and upper ureter. B. Liver, gallbladder, and pancreas. C. Stomach, small intestine, and colon. D. Lungs and heart. Answer is A. Kidneys, adrenal gland, and upper ureters. The renal arteries branch from the abdominal aorta and supply oxygenated blood to the kidneys, adrenal glands, and the upper part of the ureters. These vessels are essential for kidney functions and hormone producing from the adrenal glands, as well as supporting the uterus in transporting urine to the bladder. Question number 19. Which of the following is not a branch of the ophthalmic artery? A. Centroretinal artery, B. Supraorbital artery, C. Dorsal nasal artery, D. Transverse facial artery. Answer is D. Transverse facial artery. The ophthalmic artery, a branch of the internal carotid artery, supplies the structure in the orbit and nearby areas. However, the transverse facial artery is not a branch of the ophthalmic artery. It is a branch of the superficial temporal artery, which arises from the external carotid artery. It supplies the face, especially the parotid gland and facial muscles. Question number 20. Bilaterally diminished velocities in the common carotid arteries are most likely associated with A. Distal ischius stenosis, B. Bilateral vertebral artery occlusion, C. Low cardiac output or poor ejection fraction, D. Subclavian steal syndrome. Answer is C. Low cardiac output or poor ejection fraction. When CCA velocities are decreased on both sides, it often indicates a systemic cause such as low cardiac output, heart failure, or poor left ventricular ejection fraction rather than localized arterial disease. Question number 21. Mirror image artifact in ultrasound is most commonly caused by A. Incorrect Doppler angle, B. Low transducer frequency, C. Presence of strong reflectors such as diaphragm, D. Excessive transducer pressure. Answer is C. Presence of a strong reflector such as diaphragm. Mirror image artifact occurs when the ultrasound beam reflects off a strong reflector, for example diaphragm or pleura, and causes a duplicated image of a structure on the other side of the reflector. Too much gain can make the artifact more visible, but the true cause is the strong reflector. Helical flow observed on color Doppler imaging is most commonly associated with A. Complete vessel occlusion, B. Laminar flow in a straight vessel. C. Tortuous vessels or post-stenotic turbulence. D. Equipment malfunction. Answer is C. Tortuous vessels or post-stenotic turbulence. Helical flow, also called corkscrew flow, is a swirling flow pattern often seen in tortuous vessels, bifurcations, or post-stenotic region. Where the normal laminar flow is disturbed, it appears as alternating colors on Doppler due to flow direction changes. Question number 23. What frequency Doppler is typically used in transcranial Doppler with spectrum analysis? A. 1 MHz, B. 2 MHz, C. 5 MHz, 7 MHz. Answer is B. 2 MHz. A 2 MHz pulse Doppler is ideal for penetrating the skull during transcranial Doppler studies. This frequency provides an optimal balance between depth penetration and resolution of cerebral blood flow evaluation. Question number 24. Which of the following mean velocities measured in the MCA is indicative of severe vasospasm? A. 80 cm per second, B. 110 cm per second, C. 160 cm per second, D. 220 cm per second. And the correct answer is D. 220 cm per second. A mean velocity more than 120 meter per second in MCA suggests vasospasm. When the velocity exceeds 200 cm per second, it indicates severe vasospasm. Question number 25. Where is the inferior vena cava formed and where does it carry blood to? A. Formed by the union of internal iliac veins drained into the left atrium. Formed by the union of the common iliac veins drained into the right atrium. C. Formed by the renal veins drained into the right ventricle. D. Formed by the external iliac veins drained into the superior vena cava. Answer is B. The IVC is formed by the union of the right and left common iliac veins at the level of L5 vertebra, and it ascends to carry deoxygenated blood from the lower body into the right atrium of the heart.